Welcome back to another episode of One Clear Vision with Dr. Sophia Capo.
Hello.
And I am your host, Nikki Csek. And for those of you that are tuning in new, Dr. Sophia Capo is the owner and operator of ABC Optometry and Vision Therapy here in Kelowna.
Yeah.
And we've spent most or the majority of our time talking about eye care as it pertains to youngins or littles.
Yep.
And the conversation today, you're probably going to blow my mind again, is around low vision rehabilitation, and that lane is typically for our seniors.
Seniors, typically.
So what is it?
Yeah, what is low vision is a good question. So low vision rehabilitation falls in the realm of vision rehab. So remember the last couple of weeks we were talking about concussion vision rehab. So like getting people back to where they were after a brain injury. Low vision rehab is a little bit different in the sense that we usually can't get people back to where they were. So it's not something that we can rehab back to full function. Low vision is when we take someone who has a visual impairment. So picture macular degeneration that's pretty severe, or glaucoma that's pretty severe, to the point where they can't see very well. So we take a patient who has a visual impairment and we help them improve their function and their quality of life. So it's very different from, we can't take the retina that's damaged by macular degeneration and repair it to make it see again.
No, and we can't throw in
We can't,
glasses on
and we can't put a pair of glasses on and make it better.
Okay.
But low vision rehab works to improve function. So there's different things that we can do to get people doing what they love to do again, despite the fact that they have a visual impairment. So it's different.
So what inspired you to specialize in low vision rehabilitation, and how did background influence the approach that you take in this?
So low vision rehab, like I said, is kind of similar to concussion vision rehab in the sense that it's a lot of problem solving. So every patient who comes in has a different visual issue. They might have a different functional thing that they want to do. And then it's my job to look at all of the tools that we have and say, okay, what can I do to get this person a little bit happier in their day-to-day? And so it falls in the realm of, all the concussion patients that I see and all of the really high needs children that I see, to try and just get people doing better. The medical doctors are the ones who are looking at the health. So they want to make sure that the macular degeneration is not progressing and getting worse. But they don't do function. So it's kind of filling that little gap in between that's, okay, you have this issue and we can't fix it with glasses, so we need a person in the middle who can give you a little bit more function than what you would have otherwise.
If I substitute quality of life into function, are they
Absolutely
synonymous?
Yes.
Okay.
So someone with visual impairment might not be able to read, and let's say they were really avid readers before they had their macular degeneration.
Perfect. Exactly.
They can't read now with glasses because the glasses aren't helping to improve their vision. So they come see me, and now we look at other pieces of technology or devices to try and get them to read.
That makes so much more sense to me. Okay. So what are some common conditions you can help manage in low vision practice that example you gave is perfect?
So the big one is macular degeneration. So our macula is our area that sees center vision. So it's the area in the back of the eye that helps you with your center vision. Okay, and that's what gets damaged usually just with age. So there's a big genetic component. So if people in your family had it, you're old enough, you usually you could get macular degeneration. Glaucoma is another one. Glaucoma is a peripheral vision problem usually, but then as it advances, it also goes usually to a center vision problem as well. And then there's other ones. So I do see kids for low vision as well, but they're usually born with some sort of a genetic macular problem or a genetic peripheral problem. But the spectrum varies. Low vision is just anyone having issues with their vision, and that's impacting their function and their quality of life. So it's interesting because, for example, like the CRA defines visual impairment in terms of like a tax credit. So like if you're a certain level of visual impairment, you get a tax benefit. but that level of visual impairment is severely visually impaired. Whereas a lot of people that I see, like they might not qualify for the tax credit, but they're still struggling with their function. And so there's still a role for low vision rehab. It doesn't really matter what your vision is. It matters if you're struggling with your vision to do something. As you can imagine, sometimes with macular degeneration, you might not have poor visual acuity. So like you might be able to see things relatively clearly, but macular degeneration affects your contrast. So your contrast is how bold and dark we see things. So you can imagine you might see things clear, but everything looks faded and like it has almost like a white filter over top. Like that's still incredibly like disruptive to your quality of life. And so it's kind of anyone who is having an issue with their vision that can't be solved with glasses is who low vision rehabilitation can benefit.
So we're at an exciting time. There's so many new innovations and technologies coming. You mentioned one when you gave me the reading example, to use a technology that would help them read.
Yeah.
What other types of tools or technologies do you use to assist patients with low vision?
So outside of glasses,
Yep.
so think like magnifiers, okay? But not just like the magnifiers you can get at the dollar store. Think like prescription, large, high quality magnifiers that we can use to make things bigger, brighter. Then think telescopes, so things that we can actually connect onto the front part of our glasses that help to make things bigger, brighter. Reverse telescopes actually make your peripheral vision better. So if we take a telescope and we switch it around, instead of magnifying things, it minifies things, but that makes your peripheral vision better. And then things like different lights, different lighting solutions. If someone's vision is really impaired, then we help them with technology. So it's like, let's modify your cell phone so that you have bigger font and higher contrast font. Let's, instead, you can't read anymore and we can't get you reading even with a magnifier. Let's work at getting you a, like an Apple Home or an Alexa or something that can read to you. An audible, something, Kindle. Like something that you can do that you can modify those types of things. And usually, especially the younger population, are more open to change. And then that's how we get people functioning better.
We keep going back to the function.
It's all about doing things that you weren't able to do before, because we can't actually improve the health of the eyes to make the vision better.
Yet.
How
do we measure progress or success in low vision rehabilitation
for your patients? It all comes back to how they're doing. So in a low vision exam, someone comes in, they're usually an hour to an hour and a half long assessments. And we're going through, like the first question I asked is what can't you do now that you could do before, that you want to be able to do? And that's how we measure our success. So it's like, okay, pick 2 things that you really want to try and do. And sometimes it's even like, I used to be an avid knitter and I can't knit anymore because of my visual impairment. And so it's, okay, how can we get you an around the neck magnifier or something that attaches to your glasses so that you can keep your hands free, so that you can do your task. So it's very, very specific to whatever the patient says. And that's why it's super fun for me, because I just become like the open box problem solver thinker. So like whatever they say, it's like, okay, how do I think I can manage that? Sometimes it's as simple as I can't find the buttons on the remote to watch TV. And it's okay. So I don't think a telescope is going to be helpful for that. Why don't we just put a bumper sticker, so something tactile
that you can feel
on your remote on the 3 main buttons that you use, and then we're good to go.
That's your uncle.
So sometimes it's just a little bit of like outside the box thinking, and then the patients come back whenever they have a new problem. So it's not like low vision rehab is something that is like a weekly session where they have to keep coming back. It's, if you have a new problem, you come back and we try and find a new solution. If your vision gets worse and now our current solution isn't working, we think of something else.
So can you share a success story or 2 where low vision services made a significant impact on someone's life?
So I think so we said that low vision is something that can't be fixed with glasses. But I want to talk about glasses a little more specifically, because the big machine that goes over your head, it makes you look kind of like a bug. There's all those like buttons on it. It's called a phoropter, and the optometrist goes 1 or 2. and you never know if you're getting it right
I never
anyways.
know if I'm getting it right.
Yeah. So that machine there tries to help an optometrist figure out, accurately measure the person's prescription. So what we're doing there is we're showing you the difference between one lens and another lens, and then you're picking the one that you see the clearest with. Okay. The problem is that someone with visual impairment, whose vision is not very clear, the difference between 1 and 2 in that machine is so minuscule that they can't tell the difference anyways.
Yeah.
Because you can spin the wheel and they're going to be like, it's all bad because my vision is poor. And so what we do differently in a low vision assessment is we actually do a very manual glasses check. So instead of putting them behind that machine, which one blocks their peripheral vision because they're looking only through those tiny little holes, we put them into a different frame, and we use those lenses manually to figure out what their prescription is. So instead of giving them the difference between 1 and 2 being so minuscule, I can give them exactly. So I can do, okay, which one's better? This one here, which is a huge number away from this one, 1 or 2, which is better? And then by doing that, it takes way longer. So an average, prescription check takes about 5 minutes. With a low vision one, it's probably 25 minutes.
Oh, yeah.
But sometimes we can improve people's vision with glasses if we take the time to do our testing manually. And so I have had success with a lot of patients who just say, my glasses don't work anymore. I need like some sort of a device. And we go through, and if we spend time actually trying to adjust their glasses, we get them functional just with a new pair of glasses. It's just after you have so much damage to the eye, your prescription can change significantly. And if we're not sitting there and taking the time to do it manually, then we might not be able to figure that problem out.
Oh, how important that you do take that time.
Yes, it's really important. Yeah. And then another example would be someone who already came in wearing a pair of glasses that was the best that we could get. And their goal was to watch TV. They were like, I'm an avid hockey fan. I love the Canucks and I want to watch my TV. I can't see the puck. I can't see it. And so we talk about modifications first, of course. So we're like, how big's your TV? How far do you sit away from your TV? Is there anything that we could do functionally in your house to get this, to get it better? Unfortunately, there wasn't. He already had a big TV. It was sitting pretty close. And so we fit him with something called a bioptic telescope, which is a telescope that connects onto your glasses. Okay. And it magnifies things, but not too much that you can't see the entire screen. And essentially, he came back and he was like, I can't believe it. Like, I'm watching hockey again. I look kind of funny because I have this telescope over top of my glasses. But functionally, he could experience the game. So it's all about just improving that quality of life there.
Sorry, I'm going to
start. No, you're okay.
Joking. How do you collaborate with other professionals or organizations to support individuals with low vision?
Yeah, so low vision is definitely a journey.
Are you okay? I'm fine.
Low vision is a journey. So low vision is not just, I'm blind now, I can't do anything. It takes a lot of people, 1, to diagnose it, 2, to make sure it's not getting worse from a medical standpoint. A lot of the times it's strain on family members because these people now, maybe they can't drive anymore. Maybe they rely on their partner to do simple things that they were able to do before. And so there's a lot of resources that we need to investigate just to try and get them functioning again. So, an important step is their medical team to make sure that their vision is not getting worse. I'm an important step in the low vision world to make sure that they're functioning around their house. But the government actually has some great programs where they'll send an occupational therapist into the house to make sure that your house is optimized for you, to make sure that you know how to navigate your house properly now because you have this new visual impairment. And then, of course, there's the counseling aspect, so the mental health aspect. Like, how are you doing given the fact that your vision is now failing? And I have a few people who are even under the age of 30 who are rapidly losing their vision. And the mental health aspect is huge because now this is quality of life, this is future, this is
needing to rely on others and not being 100%. Able to be independent.
But you know what? It's actually funny because there's a few really funny Instagram accounts of blind people who like skateboard like with their white cane, and yeah, they're awesome. And
so it's, I think sometimes it can be choice.
well, I mean, I think everything's a little bit of choice, and it depends obviously on the degree of your impairment and how old you
Yeah.
are. So we can't expect someone
90.
who's a 90-year-old with severe visual impairment to go skateboarding. But especially with the advancements we have in technology, the younger you are, the easier it is for you to learn new things and adapt.
Yeah.
And I had, sometimes we even get caught in our own biases. I had he was like 92 or 93, and he just really wanted to read. And the only way we could get him reading was with a digital magnifier. So this is like it's a digital piece of equipment that goes on top of the text and it magnifies it for you. And then you have to push it across.
Okay.
And usually we can get people seeing well, but it forces you to read slower, obviously, because now instead of reading a paragraph at a time, you can only see 1 or 2 words at a time.
Wow.
And he was so determined in the best way. He was like, yeah, I need this and I can do this and I'm gonna read the newspaper with this device that I'm gonna hold across it and pull it over. And I was like, this man's awesome. And sometimes even we were like, oh, like you're 93, 94, like I don't know if, are you gonna get used to this? Is it gonna hurt your back as you're looking over? And he was like, no, like I got it. I can do it. And it's awesome.
Amazing.
So a positive attitude really goes a long way in the low vision world.
So that's family, organizations, when we talk about the therapist, and then the low vision specialist.
100%.
Okay. So what are some misconceptions about low vision rehabilitation that maybe you can share or you'd like to address?
I think a really big misconception is that, I have my glasses that, my eye doctor said is the best pair of glasses I can get. He said they can't do anything with glasses, and so this is my vision now. And cutting it at that. Because we can do so much more in terms of technology modifications, house modifications, quality of life improvement by using other devices and thinking outside the box. It just takes a little bit more time, a little more effort. And you need to go to someone who has experience doing those things. So part of my residency, that additional year that I did of school, was in low vision rehabilitation. So I spent a lot of time brainstorming with people how to make their lives better. And in general optometry school, we don't do that. We don't do a lot of that. And so my message out there, the misconception is like, if you're struggling with your vision, even if you have the best pair of glasses and, people told you this is the best your vision's gonna get, it might not be the best your function can get. And so there's always time to explore more.
Yeah, and I think your example on the remote, just make it something that you can touch and feel.
And that's a last resort kind of situation, but it helped significantly.
It solved, right? There was a problem, that was the solution, and it solved
Exactly.
it. So how do patients access low vision services? Do they need a referral from a doctor?
So that's what's really cool about low vision is you can refer yourself. You can call in and say, I feel like I have visual impairment or I'm struggling with my visual function in some way, and I want to make an appointment. So you don't have to have a certain level of impairment. There's no qualification for it. It's you feel like you're missing out on some function. Can we help to fix it?
So you had mentioned something a second ago about the extra year that you took specializing in low vision. Do all optometrists do low vision then?
No. So not everyone does low vision. Most people should know about low vision, and they should be able to give you, a recommendation as a resource. But sometimes it doesn't always happen, and that's just because everyone's busy. And like I said, it takes sometimes 25 minutes just to go through and figure out the prescription in a low vision exam. So that's sometimes the full amount of time that you get with your general optometrist. And that's okay. That's just because that's the routine that they take. And they do an excellent job at monitoring the health and monitoring the glasses prescription for the majority of the population. But for this subset of low vision patients, there is more that we can do. And even if someone has told you, maybe they forgot to mention low vision, maybe they didn't realize that the services were available here, but there is more that you can do. And you can go and you can seek those services yourself.
What advice would you give to someone who suspects they have or a loved one might benefit from low vision services?
Yeah, I think make an appointment.
Yeah. Yeah.
When you get an appointment, there is a lot of people come in and they say, wow, like I didn't even know that, like what low vision meant. I didn't even know how bad my vision was. I didn't know that there was more that could be done. And there are some people that hilariously, they will come for an appointment and then I will say, look, like you said that you wanted to be able to read. You can read if you use this device. This device is not very expensive. It's like $100. Like, do you want to get one? And they're like, no, like I can't be bothered, but I know that it's out there and it's available for me if I do want it.
Yeah.
And sometimes just that mental shift is enough for people to say, okay, like I know that I could read if I wanted to, but I haven't been reading for 5 years because I thought that this was it for me. And so now I don't really want to pick up reading again, but I know that I could if I wanted to.
Interesting.
And the mental aspect of that sometimes for people is good enough. But the majority of the time, people who do come in find some sort of a solution to their problem. And then they're happy with it and they go home and have an improved function.
So stay and we've talked about this on other episodes. You really do practice consuming as much new information as you can. So I think there's so many um, future advancements that are coming, specifically in low vision and care, and which which ones or where what area do you see a potential breakthrough or most exciting?
Yeah, it'd be super interesting. So, like evidence is very important in my practice, especially when we're doing technology bits, because there are some very, very expensive pieces of technology that you can find online that they'll say, this is going to make you see again, and like a lot of the times it doesn't, and
Yeah.
so it's very difficult. Sometimes when there's those companies that can find you from the outside. There are some really good studies going on right now looking at, like you said, trying to make the retina a little bit healthier in macular degeneration. But they're not, the studies aren't big enough and good enough yet that they're changing our minds and
Okay.
how we make our decisions. But they are out there. And so, if you're someone who's just like, I don't care, I want to try it, you totally can, and they're available.
Interesting.
There's new technologies coming out every day. Like there's an app where you can just hold it out, take a picture of something, and using AI, the app will tell you what's in that picture. So I got super like hilariously offended because I took a selfie on the app and then it said like, this is a woman who's this years old, and it was like 15 years older than I actually am. And I was like, wow, am I just looking terrible today? But it gives you like an approximate, it'll tell you facial expression. So like, this is a person who is smiling. Like this is the women's bathroom. So we have little pieces of technology that are being developed every day that are improving the way people who need accessible technology are living their lives. And so, yeah, we keep up to date on all of those things. And as they change and as new things become available, we bring those things into the office and then we let you try them. Because we want you to be able to test out the piece of technology that you're taking home, especially some of the more high-tech ones that are very expensive.
So I find that so interesting, Dr. Capo, because you've connected some dots for me that I hadn't connected yet. You look at the full self drive with Tesla and Optimus and everything that those, I'm going to call the car a robot. Everything those robots are doing is based on vision. So if we have the ability to bridge through technology of how, I mean, it's driving a car safely through traffic and it doesn't hit the pedestrian that's crossing the crosswalk. So it'd be interesting to watch these coming years,
For
like
sure.
2025, 2026 in new technologies
To see
and
what
innovations
happens.
and breakthroughs, and certainly medical, super exciting.
Definitely.
As always, Dr. Capo, thank you for coming and educating us on vision. I always enjoy my time with you, and I look forward to seeing you on the next series.
Yeah. Thank you so much.